In this video, I cover off 7 very important Medicare mistakes to avoid if you're planning on working past age 65. Coming up next on Holy Schmidt.
Holy Schmidt!
If you or your spouse are planning to work beyond age 65, you need to make some important decisions about Medicare. There's a lot of confusing and often misleading information out there that could lead to mistakes that can't be easily undone. I'm going to walk through 7 of the most common Medicare mistakes that people make and how to avoid them when working past age 65. If you've heard a few of these before, that's a good thing because it will reinforce what you already know and maybe even correct some thinking along the way on those points. But stick around to the end because even one of these can make a huge difference, thousands of dollars in costs to you and penalties to you if you get it wrong. All right, let's go. For those of you who are new to the channel, hello, my name is Jeff. I'm a CPA turned author turned public speaker. I have over 25 years of financial services industry experience, and I'm also a registered Social Security analyst. I started this channel in 2020 because my daughter asked me to do the same thing for other people that I did for my dad, who got sick at the time, like so many people in 2020. And with that, the channel was born. To date, we have over 350 videos, over 50 million views, over 4 million hours of watch time, and over 300,000 subscribers. And frankly, there's a lot going on with programs like Medicare, Social Security, and other government programs. And we work really hard to get the information that's out there in here for you. And we would love it if you would subscribe and become part of our family. We work really hard to deliver the best information to you. So please click subscribe and turn on notifications so that you get alerted the next time we post a video. We post about 3 times a week. Medicare mistake number 1, not understanding how the size of your employer affects your Medicare requirements. The size of your employer is crucial to determining if you should enroll in Medicare at age 65. If you or your spouse work for an employer that has fewer than 20 people, Medicare is your primary insurance at age 65, and your group plan is secondary insurance. This means that Medicare must pay first on your medical claims, and anything that's left over is picked up either by you or by your employer plan. However, if you fail to enroll in Medicare when you're on a small group plan, you are the primary payer for your medical coverage, and Medicare is secondary. This means that you'll be personally responsible for expenses that Medicare would cover, potentially costing you thousands, even tens of thousands or more in medical costs. And just to drive this point home, your small group plan will act as secondary insurer, whether you're involved in Medicare or not. For anyone that has small group coverage or an ACA marketplace plan, you must enroll in Medicare's Part A and B when you turn 65. Mistake number 2, missing your initial enrollment period when you are required to enroll. If you are required to enroll in Medicare at age 65, meaning that you're part of a small group plan or you have your insurance through the ACA marketplace, you must enroll at age 65. If you must enroll in Medicare at age 65 because you are part of a small group plan or your insurance is through the ACA marketplace, you must enroll during your initial enrollment period, your IEP. Your IEP is a 7-month window, 3 months before you turn 65, the month that you turn 65, and 3 months after the month that you turn 65. So a total of 7 months. For example, if you turn 65 in July, your window is April through October. Also, the timing when you enroll affects when your coverage begins. If you enroll during the 3 months before your birth month, your coverage begins on the first day of your birth month. But if you wait until your birth month or later to enroll, your coverage will be delayed 1 to 3 months. This delay creates a dangerous gap where you're the first payer on any medical claims and your employer will be secondary. And just a technicality here, if you're born on the first day of the month, Medicare treats the previous month as your birth month for enrollment purposes. Gang, while this video is very informative, it isn't customized specifically to you, and there's a lot to know about Medicare. And it's wise to speak to a Medicare advisor. We've looked for months to bring the perfect partner to you. That's why we partnered with Chapter, the only Medicare advisory firm that we recommend. Chapter has access to over 24,000 plans, saves their clients an average of $1,100 a year, and they're completely free to you. The best part is that they're friendly and easy to work with. So give them a call at 440-703-1224, even if you just have a few questions, and make sure that you tell them that Jeff Schmidt sent you. I'll also remind you at the end of this video so you don't have to stop the video. Mistake number 3, not comparing your employer options to Medicare coverage if you work for a large employer. If you work for a large employer, and that's considered 20 employees or more, you're not required to enroll in Medicare, although there might be a really good reason or series of good reasons for you to do so. The mistake that many people make is not comparing what their employer covers to the coverage offered by Medicare. Take time to compare your current costs after your employer contribution with potential Medicare costs. Look at your annual deductible, your co-pays, your co-insurance, and your maximum out-of-pocket for your current plan and compare that with Medicare. As a rule of thumb, if you're paying $200 to $250 or more for your current plan, Medicare might have a better option financially for you. And if you have a large deductible, $3,000 or more, and you actually meet it, consider that in relationship to the cost of Medicare, say $250 a month, because they are basically the same in terms of costs that you're going to pay. For comparison, most people pay about $185 a month for Medicare Part B, $140 a month for Medicare Part G, and a drug plan about $40 a month. That brings their total cost on Medicare to $365 per month. The key is to do the math so that you understand what the costs are for your different options. Mistake number 4, mishandling your HSA contributions when it comes to Medicare. If you have a health savings account and you want to continue to contribute to it, be careful with Medicare enrollment. Once you enroll in any Medicare, including the premium-free Part A, you can no longer continue to contribute to your health savings account. If continuing HSA contributions is important to your overall financial strategy, then don't enroll in Medicare's Part A and B. By the way, you can still use HSA funds for qualified medical expenses. You just no longer can contribute to an HSA account after enrolling in Medicare. This particular rule catches a lot of people off guard, so make sure that you plan your HSA strategy in conjunction with Medicare. If your spouse or children are covered under your employer plan and don't have other good options, switching to Medicare could leave them vulnerable. Children can remain on your employer plan until they turn age 26, but they are not covered by Medicare if you go on Medicare. If your spouse is younger than 65 and you go on Medicare, depending on your employer plan, your spouse may need to find coverage elsewhere. Without access to your employer plan, they may need to go on COBRA, for example, or find insurance in the ACA marketplace. If you have dependents on your plan, sometimes the best strategy is to remain on your employer plan until they find other options. Mistake number 6, mismanaging your special enrollment period if you go on Medicare after age 65. If you delay Medicare enrollment because you have large employer coverage, you qualify for what's called a special enrollment period. The special enrollment period gives you 8 months after you leave your large employer plan to enroll in Medicare without late enrollment penalties. To use this special enrollment period, you need 2 specific forms. Form L564, completed by your HR department to prove credible coverage, and Form CMS 40B, your application for Part B. Form L564 must confirm that you've had continuous credible coverage back to age 65, and COBRA, by the way, is not considered credible coverage. Start this paperwork 60 to 90 days before your desired Medicare start date to ensure that you have no gaps in coverage. Remember that your Medigap guaranteed issuance begins when you enroll in Medicare Part B, giving you 6 months to enroll in any Medigap plan without medical underwriting. If you wait too long after your SEP ends, you may be faced with additional penalties and medical underwriting. Mistake number 7, not managing your automatic enrollment of Parts A and B with Social Security. If you are receiving Social Security before age 65, the SSA will automatically enroll you in Medicare Parts A and B. Your Medicare card will arrive approximately 2 to 4 months before your 65th birthday. This mistake occurs when people keep both Part A and B and are enrolled in their large group health insurance plan. If you're already on Social Security, you must keep Medicare Part A, but you can decline Medicare Part B if you're on the appropriate employer plan. Declining Part B saves you from paying unnecessarily for Part B. In 2025, that's $185 a month, when your group plan is already the primary payer. You can always enroll in Medicare Part B through the special enrollment period when you need it. One final consideration, and that's about the Medicare Part D drug coverage. There's also a late enrollment penalty for Medicare Part D, but your employer drug program is typically considered credible. When you do eventually enroll Medicare Part D, Medicare may send you a letter asking you to verify that you did have credible drug coverage through your employer program. Your employer should provide you with annual notices that tell you that the program that you have with the employer, the drug program you have with the employer, is considered credible by Medicare standards. Keep these notices as documentation for Medicare Part D for when you eventually do enroll. Making the right Medicare decisions for when you work past age 65 depends on your specific situation. Taking time to understand the rules that we just talked about and talking to a Medicare advisor can save you from making big Medicare mistakes. Just a reminder, if you want more detailed guidance, make sure you call our partner chapter at the number above. They have what I call the 3 Fs: fast, friendly, and 100% free to you. Also, if you like this video, check out that video. Retirees spend 80% of their income in these 5 areas. This is Jeff Schmidt, and I will see you in that video right there.